views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello and welcome to Open BXRx, BronxNet special coverage providing you the latest information that matters to you during COVID-19, the coronavirus. I'm your host, Sonyi Lopez, and today is Tuesday, June 9th. First and foremost, I'd like to say that over the last few weeks, despite the odds and chaos that overtake the media, I've also seen our borough, a borough that faces its own inequities, unite peacefully against systemic oppression and racism. The civil unrest facing our Black brothers and sisters across the nation and here in the Bronx is something I stand in solidarity with on the path to justice for George Floyd, Breonna Taylor, Ahmaud Arbery, and the countless Black lives lost due to police brutality. Black Lives Matter. Coming up, we'll discuss how the Kawasaki Disease and a new inflammatory syndrome in children might be related to COVID-19 with doctors from BronxCare Health System. Then we'll learn how the Buy Black 30 Challenge encourages controlling the Black dollar by supporting Black-owned businesses for 30 days. After that, probation is an alternative to incarceration. Learn how probation officers continue to work through COVID and protest in order to keep people out of jail. And we'll get an update on 3rd Avenue through COVID-19 and recent protests in the area with the 3rd Avenue bid. Then we'll discuss how the People's Candidate Forum seeks to introduce and interview candidates for the upcoming District 15 elections. So please stay tuned. Open BXRx starts now. Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter and BronxNet Community Television on Facebook. Doctors and scientists in the United States and Europe have called a multi-inflammatory syndrome or MIS-C pediatric illness that appears linked to COVID-19 deeply concerning. Also, what is Kawasaki disease? What are the symptoms and how are these illnesses linked to coronavirus? Joining us now to discuss are Dr. Peter Sherman, Dr. Murli Purswani, and Dr. Tanya Rogo of BronxCare Health System. Doctors, thank you so much for joining us today.
Thank you for having us.
The first thing I want to learn about is about the Department of Pediatrics over at BronxCare Health System. Can you tell us about it, Dr. Sherman?
Okay, so we are Department of Pediatrics at BronxCare. Our main offices are right off the Grand Concourse, 1650. We are a comprehensive pediatric department. We have a 20-bed inpatient unit, a 5-bed PICU, a neonatal intensive care unit, a well baby nursery, and we have 4 clinical sites through the Bronx where we do general pediatrics, adolescent medicine, and specialty medicine. In addition, the hospital has a separate pediatric emergency room. So pretty comprehensive service of pediatrics, including not only medical services through pediatrics, but we have other departments. We have a pediatric surgeons who come here. We have specialists like in dermatology, in allergy. We have a fairly big psychiatric department that has a psychiatric pediatric emergency room and does a lot of child psychiatric health. So a full range of services, and we are treat the community that surrounds us too. And I've been here since I think like 1890.
Ooh, thank you, Dr. Sherman. And for Dr. Rogo or Dr. Purswani, whichever one of you can tackle this, many parents are worried about this disease, the Kawasaki disease. What is it, and what are the symptoms that parents should be watching out for in regards to their children?
So Kawasaki disease is a disease that causes an acute illness in children usually under the age of 10. And if untreated, can affect the coronary arteries, which are the blood vessels that feed the heart. And the symptoms of Kawasaki, in addition to the fever, they can have red eyes or bloodshot eyes, red swollen lips, red tongue, swollen lymph nodes in the neck, and rash and swollen hands and feet.
How is this disease related to COVID-19?
So there were reports that initially came out of the United Kingdom and since then have been reported in New York and other parts of the world of children who have a disease that looks like Kawasaki, so it's Kawasaki-like, who either tested positive for COVID-19 with like having an active infection or showed evidence of having had a past infection of COVID-19. It's still unclear yet how the COVID-19 is related to Kawasaki or this Kawasaki-like illness. That's something that we still don't know.
Got it. Thank you, Dr. Rogo. Can we also learn about the new multi-inflammatory syndrome in children? What is that? And as per the CDC's health advisory?
So the MISC, or Multisystem Inflammatory Syndrome in children, is an inflammatory condition in which several systems of the body are affected. So it can affect the heart, the lungs, the kidneys, the brain, which is why it's called multisystem. And it seems to cause this widespread inflammation. And some of these children can develop shock, can develop problems with their heart. It appears that most, if not all of these children show evidence of having been infected with COVID-19. And so we think that it is something that is post-infectious, meaning that you have the infection and then for some reason the inflammation that's sparked off in the body doesn't get turned off and causes inflammation in different parts of the body. It's a brand new thing that we're seeing. So, we're still studying it and trying to describe what it is. We still don't know a lot about it.
Got it. And Dr. Purswani, to have you chime in here, what can be done to prevent the transmission of both of these? I understand that this is still being researched, but since it is, as Dr. Rogo said, related some way to COVID-19, how can we avoid this from hurting our children?
So first of all, thank you, Sonyi and Franchesca, for having all three of us on board. We appreciate this opportunity to talk about this disease. For us to emphasize that to prevent yourself from getting COVID-19, you should do everything that pretty much we are all hearing about in the news every day. You should wear a mask. The mask not only protects you from getting it, but even more important, it protects others from getting it from you. Right. We know that many people can shed this virus and be asymptomatic, so you don't know that you are shedding it. Putting the mask on will protect you and others. Staying more than 6 feet from people is also protective. For young children, staying at home and not going out unnecessarily is very important. And for young children, wearing a mask is important, but when they are too little, you have to be careful about applying a mask on them. And I think perhaps if we have time, we can talk more about that later.
Yes, absolutely. I actually wanted to lead up with that question. Should children also be wearing masks during COVID-19? A lot of parents are concerned that that might stop the airflow from a small child. What are the regulations when it comes to that?
I can talk about that. So we recommend masks for children 2 years of age and older. It's not safe to put a mask on a child less than 2 years of age, because it can block their breathing and they can actually suffocate too. So it can be a challenge getting a child to wear a mask. It can be uncomfortable, especially now in the hot weather. So you might want to try to get a cool mask, something like maybe with an animal face. If children see that everyone else in the family are wearing a mask, that might help them go along with it. Maybe start having them wear the mask in the house. But as Dr. Purswani said, we want children staying at home. And the thing I have to say is that most children who catch the COVID-19 virus either do not know they have it because they don't have any symptoms, or they have very, very mild symptoms. So it's very unusual for a child to get, it's not more than usual, it's rare for a child to get seriously ill from getting the virus too. So parents need to be reassured about that and also reassure their children. It's more likely, and what's much more important, is that a child may have the illness, not know it, go and give grandma who's 85 with diabetes and hypertension a kiss, and pass on the infection to that person who is at much more risk of getting seriously ill and even dying too. And even when we talk about the MISC syndrome, it's still a relatively rare phenomenon as far as we know, meaning it doesn't happen in children that often. There's probably thousands upon thousands of children who've had COVID. We don't even know. And the number of children that have gotten the MIS-C is under 200. That's the latest figure I saw. I don't know if Dr. Rogo or Dr. Purswani saw anything less. So it's really, really important for parents, first of all, for parents not to be terrified about this. It's unusual, it's rare, and also to really reassure the children that, it would be very unusual for them to really get sick from getting this illness.
Thank you, Dr. Sherman. I wanted to ask about the challenges you're facing over there at the BronxCare Health System in the pediatric department. Have there been a surge of cases coming in, parents coming in with any of these issues, the Kawasaki disease? Is there a surge nowadays there?
So we haven't had quite the size of surge that the adults have had. The adults have been really overwhelmed and slammed with a lot of patients coming in. But we've had a fair amount of children coming in, yes, and they come in with fevers. And because of all the discussion about MIS-C, our emergency room doctors are very concerned and very vigilant in trying to pick up this disease. The volume isn't as high as the adult volume, but there has been an uptick in calls from the emergency room about how to manage this disease.
Right. Got it. And what should parents do if they fear their child has it? Of course, go to the doctor. But are there any measures that they can do, Dr. Rogo or Dr. Sherman, that you can address?
Okay. So if the parents have a child with fever and a rash or red eyes or any of their symptoms that seem consistent with MIS-C or Kawasaki disease, they definitely should take their child in to seek medical attention so that they can get examined and evaluated. And in general, also, if they just are concerned that the child may have COVID-19, so fever, cough, in children, we also see abdominal pain and diarrhea as well. So if they have any of those concerns, to just seek medical attention. Testing has become more available now, and the Department of Health has a phone number that you can call if you have if you need help in terms of finding a place where you can have your child tested. You can call the Department of Health, and they'll set you up an appointment at a particular testing location.
Got it. And for parents with other concerns that are afraid to bring their child to the hospital at this time or to the doctor at this time, what can each of you say to those parents?
Well, one thing I want to say too is if your child is not seriously ill, you have alternatives. A lot of doctors' practices are opening up at this point, and they're doing telehealth too. So they're able to talk with you over the phone and decide, is this something where your child can stay at home? And also they can, more and more people are starting to do the testing, as Dr. Rogo said, so you could be referred to a testing site or even be tested in a doctor's office. But it's really important. We want to, this is not over by any means. And I think our greatest fear is that people will think it's mainly gone and we don't have to be as careful. So if you're going to go to your doctor's office, we want you to call ahead of time so you can tell them that, if they decide that you need to be seen, that they can do it in a safe manner too. And they're, what they'll do is they might have the child wait in the car, wait outside until they're called in, and then not go through the main waiting room, put on a mask if they're old enough too.
Thank you so much, doctors, for your time today. I wish we had more time to speak about more things, but we'll, of course, invite you again. Now we have this relationship with each other where we can speak about children and pediatrics on BronxNet.
And we'd be happy to talk with you guys again, and we're very proud of the care that we provide here.
Thank you, Dr.
Yes,
Rogo.
thank you
Dr.
very much. And remember, hand washing and face mask, remember.
Thank you again, Dr. Rogo, Dr. Sherman, and Dr. Purswani from BronxCare Health System for your time today. Open BXRx, we'll be right back.
Who's most at risk for coronavirus? People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people, avoid crowds, stay home if you can, wash your hands frequently, learn more ways to protect yourself and others at coronavirus.gov.
Welcome back to Open BXRx. According to the U.S. Census, there are more than 2 million Black-owned businesses in the country. Amid COVID-19 and protests, many of these businesses have suffered tremendously. Buy Black 30 is a different sort of protest, encouraging people to participate in a challenge to support Black-owned businesses for 30 days. Joining us now to discuss are organizers of the Buy Black 30 Challenge, Dorissa White and Kiera Mallett. Dorissa is also a fellow reporter and my colleague here at BronxNet. Thank you both for joining us today, ladies.
Thank you.
Thank you.
So the first thing right off the bat is just, we want to learn about Buy Black 30. How did it come to fruition and why?
So I'm sure everyone across the country is very, very frustrated with what is going on. And me and Dorissa, we went to college together and we were just sharing our frustrations with each other. And we were like, we can organize. We need to get together and come up with something. And at that time, T.I. had made his proposition for us to have the Blackout Day on July 7th. And we were like, well, why not do it longer? Why not really hit people where it hurts in their pockets? Mm-hmm. And that's pretty much how it started.
Mm-hmm.
And so, oh, my bad, Dorissa, go ahead.
No, it's okay. So exactly what Kiera just said, like kind of, we just took his idea of making this one day and we were like, let's just do it for 30 days. We think that 30 days is enough time to show real economic change. And that's what we're looking for. We're looking for legislation to change police reform through this initiative.
Right. And I think it's powerful. Absolutely. I wanted to ask, through the protest, Black-owned businesses have placed placards and signs on their doors and gates identifying themselves. Let's discuss the issue of visibility amongst our communities and how this challenge can help people know where Black-owned businesses are.
Mm-hmm. I think that a lot of people don't know where Black businesses are, right? They're not aware of Black-owned businesses. A lot of people are so used to the way that they're shopping now. They're shopping at mainstream businesses. The reason we want to connect people with Black-owned businesses is to highlight that business. So we want you to replace your mainstream shopping with a Black-owned business. So say, for instance, you like a face wash and you're used to using this face wash every single day and you run out. How about you use a Black-owned one, right? Mm-hmm. It's just about changing the way you shop. As far as the placards go, I think that a lot of people, of course, times are heightened right now, right? There's a heightened anxiety right now, collective anxiety. And I think that that's boiling over with the riots we're seeing with the riots. Now, I think that Black-owned businesses should put placards on their stores to let people know that this is a Black-owned business, that, because we know once you destroy a Black-owned business, the likelihood that it will return to that area is less than 2%. So please, immigrant-owned businesses, Black-owned businesses, put placards, let people know that this is a minority-owned business.
And what are some of the challenges and stigmas that Black-owned businesses already face, even before COVID?
Yes, they face so many. So for example, a few that sometimes I hear people say, oh, they don't have the products that I want, or it costs so much more than before, like where I normally shop, not having professional, or they feel as though the customer service isn't up to par. And so, we've definitely thought about this and we have reasoning as to why people feel this way.
Mm. And let's talk about the power and value of the Black dollar and how circulating this money to Black businesses is an impactful yet simple way of protest in and of itself. If people don't want to leave home to do the protest and actively participate physically, right, put your bodies on the line, they want to be home and help in the best way they can. Tell me a little bit more about that.
The best, this is us, right? We're not going to tell people how to protest. We're not going to tell people how to express themselves. If you feel like going out on the picket lines is a way to express yourself, by all means. But this is our protest. This is a peaceful way to protest. Why spend your money in an economy that doesn't value your Black life? I refuse to. I refuse to spend my money anywhere that I am not appreciated. Black people need to go where they are celebrated instead of where they are tolerated. Mm. I think that valuing our Black dollar, as Kiera was mentioned before earlier and while we were talking, the Black dollar leaves our community with less than 10 hours. In less than 10 hours, the Black dollar is away from the Black community. In Jewish neighborhoods, the dollar circulates their neighborhoods for 6 years. That's 6 years, because they are spending it with each other, and they are spending it with each other. But we are spending it outside of our neighborhoods. We need to learn how to spend it within.
Kiera, did you also want to add to that as well?
Absolutely, because once we start spending it within our own communities, then Black businesses will be able to offer more products. They'll be able to hire more people so that we can have more customer service. Because in my opinion, actually, from shopping Black-owned businesses, I've had very good experience. And I definitely feel as though I'm not only being somewhere I'm accepted, but I'm also helping a fellow person of my same race. You know, I want us all to win. I want us all to get out here and do our best, and putting money back into our communities is essential.
And now for those who are interested in participating, how can people and Black businesses participate in the challenge, and what are the steps and phases behind it?
Okay, so it's broken down into 4 phases. So phase 1, and we're in phase 1 right now, but at any time, it doesn't have to be just the month of June. If you want to do this in July, if you want to do this in August, we just suggest that you follow the phases. So phase 1 is cutting out restaurants and eateries that are not Black owned. So, and grocery stores as well. Replace those. We suggest making a list of everywhere that you shop now and replacing that list with everything Black owned. So if that's restaurants that you want to order from takeout, if that's grocery stores you want to shop at, replace it with Black owned grocers. Now, it may be hard for some people because we don't own a lot of grocery stores. We don't have access to the food supply like a lot of other races do. What we suggest people do is shop minority owned. Phase 2 is cutting out the use of all non-Black retail stores and beauty supply stores. Removing that. And we love our lashes. We love to buy things for our hair. Black people, we change our hair so much, and it's so beautiful. But we just ask you to shop Black owned. Find beauty supply stores that are Black owned.
And you know what's been beautiful in our research? There are so many. And we've been blown away by the education that we've gained as well. So this is such a powerful movement that is not just a 30-day thing. We're learning more about who we are and how we can support each other.
Exactly.
So that was phase 2. I can do phase 3 and 4.
Yeah, absolutely.
So phase 3 is canceling all of your non-Black subscription-based services and incorporating Black-owned entertainment entities. So for me, I know that I have to mentally prepare myself to let go of iTunes and Netflix, and I there's going to be so much power in it. I just know it. So, Dorissa, did you have anything else to say about 3?
No, other than just, I think that a lot of people, like Kiera just said, it's hard to do that, right? And a lot of people are like, oh, I can't let go of everything. We just suggest remove one. And by phase 3, you're already on week 3. So there's only 2 more weeks left of the challenge. So if you are using Netflix, Spotify, and iTunes, remove the Netflix. Pick up a book.
True. There's a lot of good books out there that you can learn your history or, anything really. There's a lot of great books out there, folks. And again, it's a challenge, so it's not going to be easy, right?
Exactly. And I'm sorry.
You have one more phase.
Yes. Phase 4 is to eliminate the use of non-Black nail salons or any beauty services that is not Black.
Got you. And how have the businesses been responding to this initiative, and also the participants? I know people are excited to see this happening and coming to fruition.
To be honest, I don't think that we were prepared for the love. First of all, the love is so real. And also that people want to help. They're like, how can I help? How can I get involved? How can I spread the word? And not just Black people, right? Our allies are as well. Like, oh, okay, I didn't even know that Black-owned businesses were in this area. Like, please let me know. Show me. One of my allies today sent me a list of Black owners on Etsy. Is it Etsy? And I was like, oh, This is great. Like, thank you so much. And it's been a bit overwhelming, I'll be honest, all of the love that we've gotten, and the response has been great.
No, I think it's a beautiful action, and I thank you both and all the partners behind the Buy Black 30 movement for starting this initiative, especially during this time.
Thank you.
Thank you.
Folks, to see a list of Black-owned businesses, you can follow at Buy Black 30 on Instagram. Businesses are, of course, encouraged to participate in this movement. Open BXRx, we'll be right back.
Why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
So we're asking everyone to be selfless for others so that we can protect those who are most susceptible.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
Welcome back to Open BXRx. Probation officers work to build trust with communities and dismantle barriers, keeping people out of jail and giving many a second chance. Joining us now to discuss how probation officers continue to work through COVID-19 and nationwide protests is Dalvanie Powell, president of the United Probation Officers Association. Dalvanie, thank you so much for joining us today.
Thank you for having me today.
The first thing I wanted to do off the jump is define what a probation officer does. It's often confused with parole officers, and I think we want to define that up top.
Well, what probation officers, probation is the alternative to incarceration. We're clearly community correction / supervision. So what probation officers do, when a person gets sentenced, you have two options: the correctional facility or probation. And you hear somebody say, oh, they got sentenced to probation, I think it kind of goes over people's head. So instead of a person getting sentenced and serving time in city jail, they can get sentenced to serve time with probation. They can also as a felon, as a misdemeanor, and then they also can get time to be sentenced to probation as a felon, serving up to 5 years or more. They can serve a person can be on probation from 3 to 5 or more years as an adult and 6 to 24 months as a youth. The difference between probation and parole also is that probation serves adults and youth that have been convicted of a crime of some sort, whereas parole only deals with adults after they served state time in prison. So probation is about giving people a second chance at life and hoping that they will never go into the criminal justice system and change their lives around.
Right. And speaking of that, Dalvanie, I wanted to ask you, as a Black probation officer, you're tasked with the challenge of navigating both ends of the issue in the criminal justice system. Can you tell us a little bit about the challenge with that, especially now when we see protests and demonstrations against police brutality?
I became a probation officer because of that reason, because I wanted to see more. I want to see less brothers and sisters of color, Black and Hispanic, come through the criminal justice system. And I feel that playing that role, trying to get, like I said before, giving them another chance, giving them options in life, showing that there's other places, there's other choices that they can make better choices. Sometimes we have people, a lot of times we have people who come through the system that has no trust in the system. So what a probation officer has to do is now build that trust, build a relationship between individuals. And what we do is we encourage them by telling them that we believe in you, that we know that you can do that. We have had people, when I was a supervisor in family court, I had a kid that wanted to be a hemoglobin filled with blood. I can't even say the word.
Yeah, I don't know. Hemoglobin?
Something with blood. There's more to them than just being a construction worker or a barbershop, or they have so many talents. So what we do is we tap into those talents. We figure out with their help as a child, as a youth and as an adult, we create supervision plans. And what we do is we design these supervision plans based on the individual's needs, not because of what we're telling them that is what they should do. We give them a voice, right? We give the families a voice. It's like a circle of care. That's what we call it, circle of care. Everybody has a voice. We create these plans, and we design this plan based on their needs. And then we do a checkoff as each need is accomplished. If there's some issues along the way, then the probation officers will adjust it accordingly. But the beauty of probation is that while helping the individuals change their life or make better choices, we also hold them accountable for what they do, right? While keeping the community safe, because our primary concern is community safety. So that's what officers do. There's a whole lot of things that probation officers do. When they think about probation, they only think about the supervision component, which is both in family court and adult. But then we have in family court and adult, we have the beginning part, the entry level. which is the intake part, which is officers who in family court and adult, they conduct intakes. There's probation officers who does investigation reports before they even get to the supervision component. There's so many, people don't even know that probation officers deal with child support cases and PENS petitions. And when we had raised the age, we got a system now where kids are constantly being interviewed to keep them out of the system in our intake and our adjustment units. And we have night court, we have evening court, we have probation officer who works in Crossroads. Then in the adult, we have a probation officer that works on Rikers Island that people don't even know about. So it's a constant flow of trying to keep individuals and do everything we can to keep them out of jail.
Right. And Dalvanie, with talking about Rikers Island, the city is talking about releasing more people from there. So is this, how does this involve probation, and what is the status of the release of the inmates at Rikers?
So I know there was talks amongst other law enforcement agencies, that was not too thrilled about the mayor's decision to release individuals because of the coronavirus. So while that discussion is still going on, the workforce we have received some cases. What happened was there was a number of people who was already being held in Rikers and they were sentenced to probation. So people don't know that probation can also, a person gets sentenced to Rikers for a certain period of time and then serve the rest of their time with probation. So what happened was we accepted some of them earlier so they can be supervised by probation officers, right? To get them off of Rikers, right? And then the other part is that, I'm so sorry. And then the other part is that in efforts to reduce the people who are detained on Rikers. And then the other component is that then there was people who we're helping Department of Corrections with and getting them off of Rikers Island, and they've been referred to us. So now the probation officers are now monitoring those people that's been released from Rikers.
And how have your members been trained to work with these released from Rikers? What does this involve? So
they had to go through a training of, because they do electronic monitoring. So part of electronic monitoring, you have to put the bracing on them. So they received some training because with the coronavirus, we couldn't do it in the office. So they've been trained to do the electronic monitoring to monitor those individuals. But when they monitor the individuals from Rikers, it's a partnership with corrections and probation. Right. So.
And how have your jobs changed as a result of the pandemic?
I'll tell you the truth. First of all, probation never stops. We never stop doing our work. We do our work differently. Actually, the pandemic probably has made our job more dangerous, but that has not stopped us from doing our work, right? So instead of having probationists coming into the office and visiting them the traditional way, the probationers are now, my members are doing telecommunications, interviews with the, like something like we were doing now with the Zoom and different kind of ways with the telephones. They're still out there in the field making home visits, but they're practicing social distancing. So probation has never stopped. It's just that the way we do it, they can't come into the office like they used to for obvious reasons. So.
And what are some of the challenges with establishing that trust with the community, especially through, the way people feel outraged about police brutality and everything like that going on?
Feeling the trust. Like I said, probation officers have our primary, in order to get them to understand that we believe in them, that we know they can change, that trust has to be built. And because of what's going on now with the protesting as a result of the death of Floyd, we have to try to strike a balance. And just saying that we are calling for calm and peace and yes, change. But is that enough, right? We want to make sure that everybody in our city, in the country, in the world is at peace, and that we cannot be judged by the color of our skin or our beliefs. That we should only be, you can't look at me and say because I'm a person of color gives you the right to treat us any differently, right? Nobody should be treated differently. It troubles me when it hurts me to my heart when I witnessed how Mr. Floyd had died. I understand also that my brothers and sisters in uniform is going through a great deal of anti-law enforcement. So because of that anti-law enforcement mentality, I'm concerned about my members' safety because they're still out there. So I pray and hope that they're kept safe and that they've been trained well enough to know what to do, what not to do, and discern when and not to enter certain situations. But my members' safety is my primary concern. And like I said, being a mother of a Black male, on the personal note, that's another concern of mine, right? Because I don't want him to ever have to deal with this. And I'm praying that, but he's 16 going on 17 years old. So every time he walks out that door, I got to be concerned about how he's going to be viewed, right? So
absolutely, there's that humanistic value to this, and how we all have to band together to protect each other. I wanted to ask you about how many probation officers are there in New York, and I also heard that there are a lot of minority and Black parole officers. It's a big percentage.
Probation officers.
Oh, my bad. Probation. See, I got confused too.
It's okay. No, we have over 800 probation officers in New York City. Because then there's like 62 counties, and we're 5 of them, 57 more out there, right? But in New York City, I'm the president of over 800 probation officers, which are predominantly females and females of color. So we got more females. We got about 78%, 80% females, Black and Hispanic.
And I wanted to go back to how probation officers and the United Probation Officers Association is doing, how they're doing to assist the people that need your assistance maintaining their health through the COVID-19 pandemic. Can you tell me a little bit about that too?
As far as probation officers or the clients themselves?
The clients.
I don't know. I mean, with the probation, like I said, we're not having any contact with them directly, but what the probation officers do before they even go to the homes, they ask them, have they been tested, and if they're positive, then they don't make them home visits, and they give them the proper guidance and where to go, give them information, where to go to get themselves tested and their families. But as far as probation officers, the union has been giving out PPE to our members, and we gave it out phases 1, 2, and we're getting ready to give out phase 3, where we got them customized masks made, and the department has helped us in getting the PPEs out, and the department has also made an announcement that face masks and gloves are readily available for the probation officers if they should ask for it.
Right. Is there anything that probation officers need besides all of that? What else needs to happen in order to protect you and the probation officers?
What you mean, from the COVID or from just everything?
From everything, really.
We need everything. Right now, overall, we need to have what I've been asking for too when we start, because like I said, we never stop. So when we go into the next phase, as we start to open up more, I guess, I even asked City Council for like plexiglass. So when they go into the office, they make sure they have the plexiglass. We need bigger vehicles because we got small cars. So, since we all law enforcement, we need like SUVs, bigger cars, so we can practice safe distancing. PPE is an absolute must. And I would like to see a combination of old school and new school in the way we do probation. That would be ideal, which I believe the department is looking at now.
Dalvanie, Powell, thank you so much for joining us today, and thank you for your time speaking to us about probation officers, especially here in New York City.
Thank you so much.
Folks, for more information, you can visit unitedprobation.com. Open BXRx will be right back. Welcome back to Open BXRx. Following what we all know happened on Fordham Road, the Third Avenue BID began implementing strategies to protect businesses along the bustling commercial shopping district. And with these recent events, business improvement districts are between businesses and protesters. Joining us now is Michael Brady, Executive Director of the Third Avenue BID. Michael, thank you for joining us today.
Thank you so much for having me. I really appreciate it.
The first thing I want to address, Michael, is can you answer to the accusations of the people stating that the Third Avenue BID coordinated with the NYPD on Third Avenue, which led to the mass arrest of protesters? I would just like to clarify that the protests that began on Third Avenue were nonviolent for the audience.
Absolutely. And thank you for having me. And thank you also for noting that it was nonviolent. Yesterday's protest at the Hub was very similar to the protest that took place on Saturday. And it was a peaceful protest. To clarify things, and I know that anything I say right now will be interpreted as being the wrong thing to say. But I can only say what is in the heart of our board of directors, the heart of our businesses, and the folks that we serve, and state the facts. Third Avenue BID does not have the authority or the power to call up 250 NYPD officers. That is a fact. To lay out the facts of what transpired yesterday was very similar to what transpired on Saturday. We received an early morning notice from the NYPD stating that there would be a movement or an action at the Hub. And we have an emergency preparedness protocol internally at the organization that is directly tied to strategic planning and directly tied to just public safety. That includes, alerting store owners of the protest or of the public action, and then also encouraging store owners, if there is violence, to have their own emergency protocols in place, such as shutting down security gates, if needed, board up windows, as we saw on Fordham Road, anything that they would do to protect their small businesses. As a result of what happened on Fordham Road, DSNY removed all the waste receptacles from 3rd Avenue and 149th Street. That's something that DSNY did, not the bid. If anything, we had to deploy more sanitation crews because the garbage was now being thrown on the ground instead of in garbage cans. But I want to iterate that I know nothing that I say right now will be correct, but I do want folks to know that bids, by and large, particularly 3rd Avenue bid, we do not have the power to call one police plaza and say, please deploy 250 officers. We just don't. We've worked very closely with NYPD in their role to protect small businesses on the district. And we've worked very closely in trying to create an environment where we can better police and community relationships, whether that's by participating in the Build a Block program or hosting conversations about NYPD, substance use disorder, our LGBT community. The 3rd Avenue bid has been a convener in that. But to say that the 3rd Avenue bid coordinated the NYPD's presence at the hub is just emphatically false. And I know there will be a lot of people that disagree with that statement, but those are the facts.
And Michael, when we talk about the aftermath of the protest on 3rd Avenue, what happened? What did the bid see after arriving on scene?
Sure. So the protest at 3rd Avenue was largely peaceful. And just to let folks know, the 3rd Avenue Business Improvement District goes from 148th Street to 153rd Street along 3rd Avenue. So for what we saw in our district, everything was largely peaceful. To my understanding, the events last night transpired around 136th Street and Brook Avenue, not in the district, but that is not an excuse for us not to have an opinion on that. I think any use of police force in terms of batons, bicycles, any of the police tactics that, quite frankly, I don't know all police tactics. In that situation, I don't think was positive. It escalated the situation. Very, very similar to, I think, the curfew escalates situations. And, the events that transpired on 136th Street and Brook certainly did not need to transpire that way. I think we saw a large police force that was much larger than the protest group. And from what I've heard from NYPD, they had a large police force on hand because they thought that the protest group could swell to about 1,500 people. That's what I've heard in the briefings this morning. I have yet to corroborate that, but that's what I was told this morning.
Right. And when we talk about your position, Michael, navigating between protecting small businesses and also protecting commuters that come by and forth 3rd Avenue, what can you tell me about the challenges you face with that?
Yeah, at the heart of what a business improvement district is, and I say that 3rd Avenue is not your atypical bid, but at the heart of what we do is we protect small businesses. And 3rd Avenue is a mix of mom and pop shops and destination retail. So we have a Marshall's, we have a Burlington, but we also have Yvette's Jewelers. We also have Youngland. We also have Cookies, folks that have been around for 20, 30 years on the avenue. And by and large, the role of the 3rd Avenue bid is to serve those small businesses. Because quite frankly, the larger franchises, the Foot Lockers, the Marshalls, the Burlingtons, while they are members of our commercial corridor, they're part of large conglomerates that really don't make much use of 3rd Avenue bid services outside of keeping the sidewalks clean. So, in terms of our role, our role fundamentally is the traditional bid axiom of clean, safe, and beautiful. 3rd Avenue bid rolls out other programs such as substance use disorder programs, coalition building programs, LGBTQ programs, anti-displacement work. We do this, and I know there will be probably a lot of your listeners who say, well, that's very disingenuous. It's the white guy saying this. And I get that. I'm going to own my white privilege, and yes, I get that. But I'm also owning my ability to keep my mouth shut and also listen to figure out a path forward that's focused on race, equity, and justice, and know that I may not have a role in that, and that's fine. There are lots of other folks who do have a role in that, and we are open, we are listening, and we are eager to participate in creating a path forward. And to that end, we've been very vocal about supporting a repeal of 50A. We've been very vocal about seeing a reduction in NYPD budgets, and we're being very vocal about participating in a coalition of grassroots organizations to help drive this conversation around equity and justice.
Right. Thank you, Michael. Now, before the looting started, my co-producer Franchesca reached out to DCPI, the Public Information Department of NYPD, for anyone who's not familiar, to inquire about crime during COVID-19. According to them, crime for the most part has decreased during COVID in the Bronx, but commercial burglary is rampantly surging. Small merchants and bodegas and restaurants are being hit hard. How have businesses on 3rd Avenue been affected before all of the looting started in Fordham?
Sure. I think that this is part of a global challenge, right? People are home for 3 months. They're out of work. They're hungry. 3rd Avenue BID has participated in providing over 1 million meals to Bronxites. Things are ridiculously hard for people right now. People can't pay their rent. So when we look at the types of crimes that have increased, it makes a lot of sense that petty theft, shoplifting, stealing juice from a bodega, all of that is occurring because of the severe disenfranchisement and inequity in our community. We've been very vocal about speaking to redlining, speaking to disenfranchisement, and highlighting that. And when we look at this uptick in crime, 3rd Avenue has seen it. Our grocery stores, people don't have access to resources. And I think that just highlights the fact that we're still in a tale of two cities city. And we need to do a lot more work, and we need to be a lot better to address that. We can't just address it with words. We have to address it with actions. I'm well aware of that. And we're going to be working towards that.
Right. And one of the things I know you championed for, Michael, was the 1% small business loans that came to the Bronx. You urged for it to be a little higher. I mean, we don't know why the Bronx was last in receiving these funds or why we received so little. Can you talk about that as well? That's another fear and challenge that Bronx businesses face, especially small minority-owned businesses.
Sure. We were disgusted that 1% of city funds went to the Bronx in the forms of loans or grants as part of the COVID-19 relief effort. And we've since worked with New York City Department of Small Business Services on ways to increase their reach in the community, but also in terms of ways of just approaching equitable resources and fund distribution. In tandem with that, we've also worked with philanthropic partners, local elected officials, and community-based organizations to create the Bronx Community Relief Effort, which is a $10 million fund to deploy resources very strategically throughout the borough. And as a result of that, roughly $1.5 million worth in grants are being deployed, grant money, not loans, grant funding, grants to small businesses throughout the borough, of which, as of today, $100,000 is earmarked towards the businesses on 170th and Burnside, who were impacted not only from COVID-19, but also looting and rioting. We found that a lot of businesses, particularly our mom and pops, their insurance may have lapsed during COVID-19 because they missed a payment. So normally an insurance company would cover a burglary or a break-in, but if your insurance has lapsed, that coverage doesn't exist. So we're going to be deploying those resources as early as Monday.
Right. And when we talk about these minority-owned businesses, they've been suffering with loss of income since before COVID-19 and during the shutdown. Now, the city is expected to open in phases on June 8th, first phase. What type of businesses will be open on 3rd Avenue?
Sure. So 3rd Avenue will have some limited retail, people who are offering curbside service. But I think this also underscores the inequity in the borough, and one of the reasons why those grants and loans didn't reach our borough. We have a vast digital divide among small businesses. So, I mean, a lot of people think, oh, well, they can just order it online and pick it up at the store. That's not quite how things work on 3rd Avenue right now. We're working towards getting there, but we also have to address structural issues. For example, like if you're going to open up an e-commerce platform, chances are you want to be affiliated with Amazon Marketplace because it opens your business up to such a large quantity of clientele. However, Amazon Marketplace charges about a 40 or 50% commission on sales that go through their portal. So we're working with the city council on ways that we might be able to put a cap on that. So small businesses, particularly our smallest businesses, I think of, Sally at Yvette's Jeweler or Roger at Home Goods, how they can compete but not lose such an enormous revenue margin by going to the e-commerce route. And also this is about neighborhood stabilization. We're hearing from scientists and the Surgeon General that there will be a second wave of the pandemic. How do we prevent that from destabilizing our neighborhood and local economies yet again? And what safeguards can we put in place to make sure that doesn't happen again?
Right. Thank you, Michael. I'm not sure if this forum passed already, but the Reopening, Recovery, and Opportunity Forum was coming up in partnership with the Third Avenue bid. Can you tell us a little bit more about that?
Sure. So we're going through kind of in the weeds on, here are the tips for reopening. Anything from having your reopening plan on file so if New York City Department of Health comes by, you'll be in compliance, to other things like managing the city's open space plan to allow restaurants, bars, express food services to have more space, be it on the sidewalks or in the streets, to make sure that they can make up for that revenue gap. A lot of food service industries operate at a very small fraction of profit. When you reduce their capacity to, let's say, 20, 30, or 40%, that very small revenue margin pretty much vanishes. So, opening up more access to open space is kind of a crucial element of that. But, in long term, we have to think of how we're going to do this in a world where we have insane real estate taxes, which, that impacts the rent. When we don't have equitable city services in commercial corridors like Third Avenue bid, where we're constantly fighting for, routine sanitation pickups, all of these other things that help us create a clean, safe, and inviting community that can support the local economy. And I know a lot of folks are going to say, yes, shop local, yes, do this. But the fact of the matter is that a lot of those local businesses, they need more than just that one $30 purchase or that one $20 purchase or that one $1.10 coffee. They need to start seeing some major support from the community. If not, they will have to go by way of e-commerce, particularly in a global pandemic.
And one last thing, Michael, before you go, just some resources for businesses right now in regards to broken windows or gates, anything that they suffer through any looting that happens. Can you just give us some info?
Sure, absolutely. So if you've experienced any of that, please go to www.thebronx.org. That will connect you to the Bronx Community Relief Effort. We will begin deployment of the grant link should go live on Monday. Funds should be deployed within 2 or 3 days. It's a rapid response element. And then for any long-term questions that you might have about emergency services from SBS or emergency bid services, please feel free to email me at mbrady@thirdavenuebid.org. That's THIRD Avenue AVENUE bid.org. And we'll be happy to either provide the services or connect you with the appropriate party for those services.
Michael, thank you so much for your time today.
Thank you so much for having me.
Folks, Open BXRx will be right back.
It looks bleak. It feels bleak. But the city isn't shut down because our public services keep working. In spite of, and in the face of, the dangers, we can count on them. And to keep them working and funded, now and in the future, we need to be counted. Self-respond now to the 2020 census at my2020census.gov.
Welcome back to Open BXRx. Primary elections are approaching and District 15 in the Bronx has a big decision to make, selecting a new representative for Congress after 30 years of service by current incumbent Jose Serrano, who is retiring this year. The People's Candidate Forum is a forum by the people, for the people, seeking to individually interview and introduce you to all 12 candidates in this race. And it's being presented by BronxNet and Nos Quedamos. Let's check out this clip. The Bronx is hiring. If you live in the neighborhoods of Mott Haven, Hunts Point, Melrose, Highbridge, Morrisania, East Tremont, Morris Heights, University Heights, Belmont, Fordham, Bedford Park, West Farms, the Long Avenue Historic District, and parts of Soundview, we need your help. Election Day is Tuesday, June 23rd, and we've received plenty of applications for the U.S. Representative of District 15 for the seat of Congressman Jose Serrano, who is vacating after 30 years of service. A congressperson is elected to a 2-year term serving the people of a specific congressional district. Among other duties, representatives introduce bills and resolutions, offer amendments, and serve on committees. To check who's running for this very important seat to represent you, visit ballotpedia.org and click What's on Your Ballot to see your sample ballot and get familiar with the candidates. Due to the COVID-19 pandemic, Governor Andrew Cuomo has signed an executive order allowing all registered eligible voters to vote by absentee ballot. This means that if you cannot get to your polling place on June 23rd, you can still exercise your right to vote by submitting an absentee ballot. First, you must apply for an absentee ballot no later than June 16th. You can apply online at nycabsentee.com, through email to absenteejune2020@boe.nyc, fax to 212-487-5349, mail to your local borough office, which can be located on vote.nyc, or by calling 1-866-VOTE-NYC. That's 1-866-868-3692. Once you receive your absentee ballot, it must be postmarked by the day before Election Day, June 23rd, and must reach the Board of Elections no more than 7 days after the election to be counted. The early voting period is June 13th to June 21st. If you're headed to the polls for early voting or on primary day, you are required to wear a mask or face covering and maintain 6 feet of distance when entering any Board of Elections facility. Before casting your vote, you have the opportunity to learn about the candidates and issues in your community on your BronxNet TV channels. Watch our People's Candidate Forum in partnership with Nos Quedamos, premiering on BronxNet Wednesday, June 10th at 7 p.m. on Channel 67 Optimum, 33 Files, and on BronxNet.tv, as well as our Facebook pages at BronxNet Community Television and Nos Quedamos. Stay informed, and most importantly, make sure you mail your absentee ballot the day before Election Day, June 23rd, or safely head out to the polls to have your vote count and your voice heard. The People's Candidate Forum will be taking place on Wednesday, June 10th at 7 p.m. You can tune in here at BronxNet on Optimum 67, Files 33, BronxNet.tv, and on Facebook at Nos Quedamos and BronxNet Community Television. Don't forget to vote. That's all for our show today. Thank you for tuning in to BXRx. I'm your host, Sonyi Lopez, wishing you and your family safety and wellness now and always. Until next time.